Hello, everyone, and welcome to our learning hub titled Building Diversity and Inclusivity Through Engagement. We are happy to have you guys. My name is Janelle Linton. I'm the Community Engagement Research Project Manager, and I'll be introducing our MC for the night. So I wanted to introduce our moderator for tonight. Her name is Teresa Akintoa, and she has been an educator for over 25 years with extensive experience in instruction and corporate training. Since becoming a long hauler after her initial COVID infection in February 2020, she founded the Black COVID-19 Survivor Alliance and Support Group, an online patient prioritized community aimed at helping African Americans overcome the misinformed and social stigma of COVID. As president of the Black COVID Survivor Alliance, she now collaborates with various organizations to increase health equity through community education and participation in health research. She's also a member of our National Community Engagement Group. Teresa, feel free to start your presentation.
Thank you, Janelle. I appreciate it.
No problem.
Welcome everyone to the Building Diversity and Inclusivity through Engagement session. I'm glad that you took the time to come here today. As Janelle introduced me, I have had some experience with the Recover program. I believe I joined last year in the fall. And I found it very important just as a patient and an accidental advocate to do as much as I can that would be patient facing. A lot of times, some of our organizations do a lot of work with legislation and some of the higher up things. And just letting you know that our organization really wants to help the long COVID patient as much as possible. So this is our agenda for today. So now I want to introduce to you our speakers for today. We have Al Richmond. He's the Executive Director of Community Campus Partnerships for Health, an international membership organization whose mission is to advance health equity and justice through partnerships. In his role, he is advancing the organization's commitment to social justice and health equity. In response to COVID-19, Al leads multiple projects associated with efforts to mount a coordinated response to COVID-19, including the long-term COVID. This includes co-lead of RAD UP Community Engagement Core, co-principal investigator of NCEG, and as a team lead for CCPH's work with the Recover Project. Thank you, Al, for being here. Next, we have Melvin Jackson. He has over 35 years of experience in community engagement, public health research, and program coordination. Beyond his work with the clinical scholars, he is the public health advocacy coordinator and local improvement advisor with the Alexander YMCA SCALE, which stands for Spreading Community Accelerators Through Learning and Evaluation program. In his role with CCPH, he is a consultant to the Recover Project with the intent of supporting the engagement of communities disproportionately impacted by COVID. Thank you, Melvin, also for being here. So now we'd like to lead into your presentation from CCPH.
Thank you, Teresa, and thank you also to Janelle and to others who coordinated tonight's session. It's really a pleasure to be with you. I want to welcome you to about a 45-minute conversation or less. We'd certainly love to hear from you, but this is a time to describe the work of CCPH as it relates to the Recover Project, but also an opportunity to really take a deep dive into our perspective and commitment to diversity and inclusivity of individuals, not just in the Recover Project, but similar projects that have been launched across the U.S. in response to a global pandemic. I want to acknowledge my co-presenter tonight, Melvin Jackson, who is one of 3 consultants who is working with CCPH to support the Recover Project. Others that are supporting this work include Anita Holmes and Ramon Lamas. I also want to welcome a new member of our CCPH team, Olivia Redd, who will serve as the program coordinator for CCPH's engagement in the Recover project. So thank you for being here tonight, and let's get started. So our overview tonight, our agenda and commitment tonight is to provide an introduction of CCPH to some of you who may not be familiar with who we are as an organization, to provide also a framework of our work and commitment to authentic partnerships and engagement, and then really to highlight the importance of inclusivity. So I want to talk some about CCPH. We are an international nonprofit that is based in the Research Triangle Park of North Carolina. This year is really exciting for us in that we're celebrating our 25th anniversary. Our work was founded by Dr. Serena Cipher with a commitment to building partnerships between academic institutions and the community to really advance health equity and social justice. A lot of our work focuses on building partnerships with academic institutions, philanthropy, but also with other nonprofits. When I think about CCPH, what I say to people is that partnerships is who we are. It's in our name. It's what we do. It's really center of what we are committed to as an organization. So our mission is to promote health equity and social justice, again, through partnerships between communities and academic institutions. But we also work with anchor institutions. And I think the importance of anchor institutions has really been centered in this current pandemic. Anchor institutions might include faith-based organizations, mutual aid societies, fraternal organizations, a volunteer fire department, a business. Depending on the community that you're in, anchor institutions can vary. If you're in a rural community, it can be a volunteer fire department or a faith-based organization. If you're in an urban center, it may be other entities that really do anchor an institution and are there and are a source of strength, a source of resolve and commitment to the local community. We value health very broadly, such that when we think about health, we don't just think about the physiological aspects of health, the physical aspects of health. We think about the total person. We think about mental health. We think about spiritual health. We think again of health very broadly. And we emphasize partnership approaches. We believe that no meaningful impact can be achieved without partnerships. We believe in the fundamental need for healthier communities, and we are committed to social justice and strive to model equity and justice in all of our work and how we allocate even our resources as an organization. For many years, this model of authentic partnerships has been something that has really served to really embolden me to really understand the importance of partnerships and the power of partnerships in really creating sustainable change in our communities. When we talk about partnerships, we describe these as authentic partnerships to differentiate between those partnerships that may be more casual in nature, but authentic partnerships are partnerships that really facilitate win-win relationships. They are intended to benefit all of the partners at the table, such that we don't leave any of our partners behind. Anchoring our this model are four key elements. At the top, at 12 o'clock, you see the guiding principles of partnership, and I'll talk some about these. These are 11 principles that can be found on our website that really guide the partnership. They talk about multiple ways and the myriad of ways of knowing, but they also talk about the fact that partnerships will, start, but they will also, they may resolve or dissolve over time. The next piece of this, the element is quality processes. Quality processes speaks to how we do the business of the partnership. How are decisions made? What structure that we put in place for the work of this partnership. It also speaks to governance in terms of how are decisions made. Are they made by consensus? Are they made in other ways? In different communities, decisions are made in different ways. Quality processes speaks also to the business of the partnership in terms of, is it a community advisory board or similar kinds of groups that can be stood up in a partnership to really provide leadership and structure to creating a partnership. So that's quality processes. It's the business of the partnership. All partnerships have business, right? So all businesses don't have partnerships, but all partnerships have business. And it's important to think about what are the quality processes within that partnership. Second or third is the meaningful outcomes. Meaningful outcomes really speaks to how we work through the partnership to achieve meaningful outcomes for all of the partners. Oftentimes, we find that within academic partnerships, academic community partnerships, the outcomes are weighted towards the academic institutions or philanthropy. But meaningful outcomes for us, in particular for community partners and community organizations, is maybe very different. On the academic side, meaningful outcomes may be to secure additional funding or funds for the project. It may be publication of scholarship publications. It may be tenure and promotion. And we've been involved in tenure promotion practices for many, many years, supporting academics who are engaged in scholarship and in particular engaged scholarship. But to the community, it may be something very different, and such that we believe that authentic partnerships recognize creating a partnership that really does seek to understand what's important to the community. It may be jobs, employment, it may be other things that are essential to them. Most recently, during the baby formula fiasco in the US, and that was very highly publicized, meaningful outcomes in partnerships may be to really secure baby formula for people in the community. For people with COVID, it may be issues around the quality of life. So there's a lot of variability around meaningful outcomes, and it's critically important to each partnership to establish upfront what are those outcomes that are important to all of the partners that are engaged in that work. Finally, transformative experiences. I love this one because this is so important to all of us, and it's important to me as a leader. Transformative experiences really speaks to how can this authentic partnership transform those individuals, institutions, groups, and organizations that are part of the work. So transformation can take place on multiple levels. It can take place on an individual level. How am I transformed as a leader? How does this partnership serve to transform me as a community advocate, as a health advocate? We have examples where through partnerships, community leaders have decided to go back to school and secure additional education, employment opportunities, certifications. That may be very transformative for that individual. We also have examples where transformation takes place at the institutional level, such that there may be policies that are changed as a result of the partnerships. How we reimburse communities and community organizations for their engagement in the work. That's transformative. So our work should always center these principles, these ideas, these elements of quality processes about how we do the business, what are the outcomes of the partnership, and what are the transformative experiences that can take place as a result of the partnership. All of these are elements of the principles of partnership. And really, when we think about inclusivity and when we think about diversity, it really has to be centered in the partnership, right? So oftentimes what I say to people is that when you start in inequity, it yields or produces inequity. So when you have equitable partnerships, it really facilitates inclusivity and diversity. Diversity, not just in terms of racial, ethnic, or gender, but also diversity and inclusivity as it comes to thoughts and ideas. So for us, in terms of the principles of partnership, we kind of distill these into these concepts, these four. First of all, the partnership builds upon the identified strengths and assets, but also works to address the needs and increase the capacity of all partners. When we do this, we actually are facilitating and moving the organization forward as it relates to diversity and inclusivity. The second element is that the partnership balances power. It's always the power. Power is always present and it's always in play. You've heard of the adage, the golden rule, he who has the gold makes the rules. Well, power is embedded in money, all of these in resources, such that the partnership balances this. It seeks to mitigate this imbalance that oftentimes takes place as a result of partnerships in a traditional way. And so what we really want are authentic partnerships that balance and mitigate that. Partnerships share the benefits of the partnership's accomplishments. So whatever is done in the partnership, we share the benefits of it. We share the resources, we share the credit that's given. We actually believe that we share even in co-presenting the work, that it's co-created, not just by academic partners or federal agencies, but it's co-created by and through the partnership. Partnerships consider the nature of the environment within which they exist as a principle of their design, evaluation, and sustainability. It's always about the context and the nature of the environment. Rural, urban, what is the history of that partnership? Taking all of those things into consideration, we've done a lot of work around historic racism and structural inequality. And again, this is an example of it because the work is always contextualized to the environment, to the geopolitical environment where the work is taking place. And finally, the partnership values multiple kinds of knowledge and lived experiences. When we think about COVID-19, when we think about long COVID, that real experts around long COVID are those individuals who live every day with this chronic condition. The novel nature of this particular virus, but also living with COVID, positions the patient and their family as really being the purveyors of knowledge because of the lived experiences that people are having. So we want to center this idea of really valuing the lived experiences of people. Can't say enough about that. And I'm sure those of you who are joining us tonight, who are part of that community and are caring for and living with long COVID, you are the experts in this work. So I want to share with you some work by a good friend and colleague, Dr. Consuelo Wilkins, who has put forth this idea around optimizing diversity and inclusivity by giving voice to groups often underrepresented or excluded. And it's important that we, give some attention to this word excluded, because people don't typically exclude themselves. They've been excluded by historic trauma. They've been excluded by structures, by institutions that have systematically excluded them and muted their voices. People are underrepresented not because of themselves, but they're underrepresented because of decisions that are often made at the highest levels. So when we think about diversity and inclusivity, it's very broad. So when we look at this list includes racial ethnic groups, but it also includes sexual and gender minorities, seniors, parents and children. People living in rural communities are oftentimes excluded because of a lack of bandwidth. Sometimes I say to people that the decisions that are made on the East Coast don't make it past the Mississippi. That's true. They don't often penetrate into rural, urban, southern communities. When we think about inclusivity, we also want to think about those of limited education or literacy, individuals who are blind or with limited vision, individuals without access to the internet, individuals who are deaf or hard of hearing. So diversity and inclusivity is not just limited to race and ethnicity, but it's a myriad of factors that come into play, and not to mention the issue of intersectionality, such that none of these are mutually exclusive, but they are, there's a lot of intersectionality. So it's about that older person who lives in a rural community, who may also be deaf. It may be about that African-American individual who also represents other groups as well. So none of these, again, are mutually exclusive. And that's important. It's not just enough to check off a box and say, we have this person or this group represented, because again, we have to think about that inclusivity also speaks to intersectionality. So while this work, the work of Dr. Wilkins, focused on precision medicine, it's also important for us as we think about the work of Recover. It's about individuals who are homeless. How do we include, how are we intentional about including persons who are homeless, who have COVID-19, or individuals who are transgendered, men and women? All of these things have to be taken into consideration if we really want to facilitate and build equitable, diverse, and inclusive environments. So I'm going to actually pass this off to my colleague, Melvin, to talk a little bit about this particular slide and subsequent slides. But I'll just say, in passing this off, that this is a community engagement continuum that both of us actually use to really highlight how community engagement can be facilitated and can really facilitate inclusivity and diversity. Melvin?
But we always like to use this community engagement continuum and ask people, as you look at it, think about the work that you're doing. If you're doing community engagement, if you're doing research, community academic research, medical research, always look and see where you are on this in this continuum, because it represents increasing level of involvement. It starts with outreach, and many times researchers come to the table asking patients and communities leaders to provide outreach, find patients for us, to find patients to be involved in the program. And yes, that's important and that's necessary. But also it's important that there's some consultation involved in that. And outreach is one way. You give them patients and they go forward. Consultation allows communities and patients to provide their voice. It does not necessarily mean that the researcher is going to use their voice, but it allows them to share their voice. And we're hoping that it would be more than that. Involvement, that is really being involved in the project, helping to design it, helping to analyze it, and being involved in a meaningful way. Collaboration, to be honest, that's the space that I think that most partnerships should thrive for. That's not to say that you don't want to go to shared leadership, but shared leadership sometimes takes years and years and years. But creating a collaboration that is bidirectional is very important. So if we can move projects and work towards collaboration, that's very important. And the work that we're doing with Recover, that's what we hope to be able to do. Okay, we created this image to help us understand how we're going to be involved in this work. And we call this our community engagement knowledge building process. We see the center of this work as all the leadership, the NCEG, and all that's involved in that. But our role is to listen to the community, listen to the community leaders, community organizations, and to take their voice and share it up and down. So that's why we got those arrows going both ways. We're also planning to do an equity summit, taking all this information, pulling it together, and it is a lot of information, pulling it together, and not only benefiting Recover, but also benefiting the community as well. And we're going to be engaging community organizations and as well as the broader communities. And as those arrows on the left, it's very important that it goes all the way from the center back to the broader community to understand that where they fit into this work. This is our approach for this work. And it feeds off the initial slide. Our engagement involves doing a series of listening sessions. We're planning at least 10 listening sessions, listen to at least 100 individuals or organizations. And they're going to be diverse across ethnicities. We're talking about doing sessions or including individuals that pregnant women or mothers with newborns, as well as the disabled. We're looking at involving the youth. We want to hear from just about anybody that could be impacted by COVID, as well as then moving into the long COVID. Out of those 100 participants, we are also going to extend to do a set of 75 surveys, knowing that everybody's not going to participate, but we are providing incentives for them to be involved in this work. And recognizing that there are some organizations, some individuals that cannot pinpoint the time to be involved in the listening sessions or the surveys, we're going to do key informant interviews with them as well. And so and we're using that information, as I say, bi-direction. It's going into the COVID recovery, and it's also that information is coming back out in terms of individuals understanding how it benefits them. Okay, I was concerned. I was looking at my phone, and these slides weren't showing up. So we have completed one of our listening sessions. We included people across multiple ethnic groups. We had a total of 20 people involved in the sessions. And these are some of the key concerns that we got, and we consider these people with lived experience. The fear of contracting COVID for risk of long COVID and potential for long-term COVID. So it's really risk diverse. They're really concerned about how to keep from being in that space. Very important. We heard from caregivers and employees the debilitating effect the individual is dealing with this extreme fatigue impacts the quality of life and productivity. So, and as well as we know that we're trying to get individuals to eventually become a part of the observational studies and then probably clinical trials, it's very important that their awareness, they understand some of these things. And also we had parents in the room, and their extreme concern about the residual effect of their family producing a rippling effect of distress. I mean, it affects everybody. Some of the recommendations, the underlying mental health impact of COVID and long COVID. And we were encouraged through our sessions to make sure that we're taking a trauma-informed approach to doing this work. As well as listening to the stories of real people, individuals that have been impacted by this work. That will allow us to segment and tailor messages based on the common beliefs, that because you have people in different places here. Can't see the last one, but I think it's authentic engagement, and we need to create a nurturing online community to support those with COVID who have experienced COVID as well as long COVID, because they're a lot. And right now, they're not knowing what to do. They're not hearing everything they need to hear from their providers, and it's very important that we can get them connected. Other recommendation, community engagement is a labor-intensive and not easily and rapidly scaled. And that's something that we need to be very aware of. And we have to meet the communities where they are, especially at the speed that they are functioning. And these are the things that we were hearing from individuals. We had some folk that were from subgroups of providers, clinical providers. And so leveraging existing channels. We had a dental hygienist saying, well, I think I can do, I'm learning more about this through our sessions, but that's a place, community health workers, and we're engaging community liaisons. These are individuals that have impact and access to communities. And going back to that continuum, we're not asking these community liaisons to just provide outreach, provide individuals to be a part of the program. They're going to be a part, and they are a part of our think tank in terms of how we move this work forward. What are we not considering? And how do we make sure that we're listening to all the diverse, inclusive groups that we need to? And developing a relationship with professional subgroups for long COVID awareness can be incorporated in existing workflow. So that means basically them being able to have enough knowledge to share with individuals that come in contact with that may be suffering from or experiencing these symptoms and not knowing and recognizing that they could be connected with long COVID.
Hey, thank you, Melvin. I want to just again say thank you for joining us this evening. We're going to open up now for a time of questions and response and engagement from you. We encourage you to find out more about CCPH by visiting us at our website at ccphealth.org. There's our Twitter handle, Facebook, and LinkedIn. And want to thank Dr. Williams and the team for inviting us to be a part of this. I'll turn it over to our moderator now. Thank you.
All right. Thank you very much, Alan and Melvin. So we're opening up our Q&A right now, and I'm sure you've probably had all types of questions that came in mind as you really listened to some of these very specific and guiding details about how we can engage with diversity and inclusivity. Well, while we're waiting on that, and I know that we have some people who are going to ask some questions in the chat or the Q&A, Alan and Melvin, what are some of the authentic partnerships that can help promote justice? You talked a lot about partnerships. You talked a lot about, leveraging the connections that we already have. So how do those authentic partnerships help promote social justice?
As I was listening to Melvin's comments and thinking about where we are within the pandemic, that we recognize that all of this work has to move at the speed of trust. So we have to we're in this really precarious situation right now in that we have not done our best work in building partnerships, even really authentic collaborations. But it's at this moment, in the past 18 months, 2 years, that we recognize the importance of authentic partnerships. The whole movement, I think, around mistrust, low vaccine uptake in many communities is really predicated upon the lack of trust that individuals, communities have, and rightly so, against formal institutions and organizations in this country. So we have to repair some damage that's been done if we really want to move forward in the space of authentic partnerships and then facilitate authentic engagement and diversity and inclusivity. So there's a lot of work. This is not fast work. This is actually slow work because you are undoing a lot of work that precedes you. Now, a colleague was sharing with me the story about an academic leader who was going into a community, and they said they were talking to the community, and the community was being very frank with them, and they were describing themselves as being a very nice person, a very trusting person, and all of that. And the community said, this has nothing to do with you as an individual, but everything to do with the organization that you represent.
Thank you. Thank you.
You know? And so we have to recognize all of that and take all of that into consideration. So I think for me, again, it's really about repairing some of the damage that's there and really moving people, you know, just building those relationships. People do business with people that they trust. That's how all of us are, right? And communities are no different. And so when we think about diversity and inclusivity, that's why when Melvin was talking about the intentionality that we're given to this bi-directional approach to hearing from the community, sharing it back to them, and then sharing it with others, and then sharing it back to the community. The community has to know that we hear them, that they've been heard, and then that the information that we're taking from them or extracting is actually being used appropriately to really correct and build out the work.
Right. Melvin, what did you want to say?
I want to add one thing, and I never talk about this work unless I talk about equity and race equity. It is important that we get people vaccinated. It is important that they get the care, that they get tested. But the issue is the system. We need to take advantage of this time to modify and change the system such that we don't have to face this anymore. I mean, I won't say anymore, but we need to change the system. We're trying to fix fish versus trying to fix the systems that's involved.
Yeah, Melvin, we talk about that a lot. We engage in fish fixing as opposed to fixing the lake. It's not the fish in the lake. It's the polluted waters in which the fish are swimming in.
I want to see real quickly if we have any questions that are coming from the chat or the Q&A. Janelle, if there are any, you can go ahead and read them.
Yes, so we did receive one from Alan. Thank you for your question. I'll read it out. We are currently halfway through recruitment for Recover participants. It doesn't look like the findings will be collected in time to be used for recruitment. How will the information gathered be used with Recover? So this is more of a Recover geared question.
Yeah, I think if Alan is referring to the information that we are collecting, we're trying to speed up the process by having as many listening sessions as possible, and then share that information back with the Recover leadership team, with NIH, and with NCEG as well, to incorporate that in real time, in a rapid manner, to make some really important changes. I just want to step back and say that part of our work is actually, it's interesting. It includes just really giving people space to talk about long COVID. For many, it's amazing to be in these listening sessions, because for some people, it's the first time that they've ever been able to really talk publicly about what they're experiencing. Some people just feel so isolated and cut off from so many other people. So, part of our work is to give people a platform. The second thing is to even inform people about the realities of long COVID. It's so isolating for people. Even we've heard stories that people just don't even feel like their families believe them.
Right. Alan, and speaking to that right now, you mentioned earlier about when we are partnering with anchor institutions, there needs to be a win-win situation, right? And one of the wins for patients is having that platform, as you just mentioned. Mm-hmm. What would be some other win-win situations that you think that institutions can implement that will help also to build trust?
Teresa, I think one of the other examples is to really look at the social determinants of health, right? To see people not just as a participant in a research study, but to also ask people, what are the other needs that you have?
Right.
Do you have food? Do you have housing? Are you housing insecure? All of those other things are so important. So we have to care about the total person. So I think that that's one of the ways that we can actually build and facilitate trust and build authentic partnerships, is to just really get to know people and ask them, what are the other needs that you have? And we're seeing changes. We're seeing systemic changes occurring in healthcare systems when they're actually assessing people about their housing and about food insecurity and all of these other kinds of things. I think all of those things are important to building partnerships and really strong relationships.
Great point. And especially about the aspect of, really wanting to see things kind of come back around, right? As far as, we're not just giving as patients, but we're actually seeing that reciprocation. Patients, as a patient myself, we want to know that, you're not just looking at us as a population, right? That we are patients, not a population. I think that's one of the things I have on the Black COVID Survivors Facebook group, because we do have to speak to the whole person. And COVID has definitely impacted, all these aspects that you mentioned, including people's careers, people's relationships, how families function. Long COVID has had that, huge impact. Before I continue, are there any other questions, Janelle, that we need to get from our audience?
Yeah, we have one that says, do you have a process in place? Sorry, Janelle. Do you have a process in place to disseminate the findings to the community participants in a quick turnaround time? Yes, we do. So we just finished our first round of listening sessions. And so we'll be sharing some of those results with them as well, such that they know that, they've been heard. I just want to Teresa's point.
Can I say that they work? I mean, we immediately give it back to them. They got theirs. When we sent them their survey, we shared with them their results.
Yeah,
that's awesome.
And that'll occur in the future too. But yeah, this is not just an extracting information, but sharing information as well.
Absolutely. I've seen some studies shared and information from Recover on the website that would help to inform people about research in general and what the steps would be if they decide to get involved. But when we think about some of these, we talked about intersectionality, right? And I saw in the comments, someone mentioned neurodiversity. And speaking to neurodiversity, how, can institutions or programs like Recover disseminate information, the results of the research, in a way that helps those who are even neurodiverse and, not just on an academic and, straightforward type message? What's going to make people want to hear the results?
Yeah, so we have to think about different strategies. We need to engage representatives of those communities and really ask them. I think that's the main thing, is never assume that we know. And I will not assume that I know. But I think asking advocates and others in those communities, what is the best way to disseminate information back to you? We've been using different strategies, visuals through like infographics, plain language, other types of ways in which we're using to really kind of demystify the content and to really convey the information in a really plain way to everyone. I think that we recognize that list of people, including people who are visually impaired, who are blind, just thinking about different ways to be more inclusive and being intentional.
Thank you.
Thank you. I do see a question in the chat from Marilyn Peters. Her question is, who within the system will the community trust to ask questions relating to identifying those SDOH barriers?
Who within the system will the community trust? I think Miller talked about community health workers, community health workers, and other trusted voices in the community to really amplify this issue of addressing the social determinants of health. We're all aware of the increasing cost of living. We should be aware of it each day we go into the grocery store, but also the increased cost of living. I live in the Triangle region where housing prices are topping $500,000 for the first time ever, the average median cost of a home. So think about layering that on with someone who has long COVID, who has not been able to work. There's so much that has to be taken into consideration. And that's why I think that the Biden-Harris plan around long COVID is so important, because we have to think about issues around disability. We have to think about issues around employment, all of these things. Melvin?
Oh yeah, I agree. I mean, it's those trusted voices, those people in the community that they talk to all the time, individuals that tell their real story of their experiences, and that's where it comes from. Sometimes I say family members, but sometimes family members do just as much harm.
They're not always the best ear, right? Thank you so much. We've run out of time for our our Q&A session, but I think that we've gotten just so much very, I would say, meat in the presentation. We heard a lot of stuff, I think, that would be very beneficial to representatives who are involved with COVID. We heard about making sure that not only that we have win-win situations in the community, but that we also have transformative experiences. And I would say, you know, the building of leaders, of the grassroots leaders through forums like this, having learning hubs, you know, is one example. You also mentioned having meaningful outcomes, right? So maybe every participation, you know, with research is not going to lead to, you know, a direct treatment recommendation, but there could still be other meaningful outcomes that representatives can help the community to see, you know, their impact on community, their impact just overall in the world. I heard about power being embedded in money. That was a really strong statement. That kind of, you know, it kind of shook me. But that's a big part of it, right? We have a lot of research that's going on, lots of money kind of changing hands and whatnot. And so community people do see the power being institutional, because we see these, you know, institutions with all this money, but we have to find ways that we can kind of bring it down and let them, you know, feel that balance, not only with a balance of participation, but also with the leadership and the engagement. You all gave us a beautiful guide, a visual guide on community engagement on the continuum. And I never really thought about, you know, it being on the continuum before, but that impact, trust, community, and engagement are all part of that continuum. And, you know, as continuums happen, sometimes we go forward, but sometimes we might go back a little bit in order to move back forward. There are health summits and things of that nature that you all also mentioned, the listening sessions. We heard about engagement surveys and also key informant interviews. So these were just wonderful things that I hope people took note on, but if you didn't, our session has been recorded so that you can go back over it and look at it again. And then finally, as we just really had a really enriching time, your recommendations, you know, I feel like I can walk away with a toolkit after hearing Alan and Melvin. There were some key concepts about recommendations. So the mental health aspects of it, making sure that our leaders and our grassroots workers have trauma-informed care as part of their work. Hearing real stories, very, very important to let people express themselves, and family isn't always the best ear to listen to. And then, yes, it's going to be very labor intensive, but despite that, I think that with that labor, we will definitely start to see change and impact and build a building of trust. And again, finally, leveraging the different channels that we already have. Sometimes we try to reinvent the wheel, especially as new leaders in the community, like myself. I call myself an accidental advocate, but leveraging what we already have is what you mentioned. And all of these things were awesome recommendations that can actually enable us to, you know, have an action plan, you know, tomorrow and move forward. Thank you very much, Alan and Melvin. We appreciate everything that you gave us today. I know there's so much more that I want to delve into, and I'm sure some people in the audience as well. But right now I'm going to turn it back over to Janelle.
Wow, thank you guys so much for such an engaging conversation. I want to thank Al and Melvin, and of course, Teresa, for this amazing opportunity to sit and listen to this. I think our community walked away with, as Teresa said, a toolkit of information. So we did want to give you guys some more information. So a few more thank yous. So thank you all for attending. Here are a few ways for you guys to stay in touch with us. So you can go on the recovercovid.org website. You can also send us an email. And in the chat, Carlos has posted a follow-up survey. We want to make sure that you guys are enjoying these learning hubs. And we also want to make sure that we improve every single one that we do. So if you can provide your input in that link, he's going to link it again at the bottom in the chat for you guys. That will be amazing. We have more of these. So we're taking a little break in August to reflect and ramp back up for September. So we'll be having our hub site spotlight, where speakers from each site will present how they prepare and put into action their community engagement plan. So we have a few of our local hub sites that will be attending and speaking about their engagement activities. And that will be September 15th at 5 p.m. So feel free to register for that. We will be sending out our invitations very soon, but this is more of like a save the date. So, be on the lookout for that. And once again, I want to thank you guys for attending. I see that it's 6:57. If anyone else has questions, please feel free to ask. But if not, you guys can, take your time and leave the session. But we want to thank you guys so much for attending and being here with us today. And thank you again to CCPH and Teresa and Recover for being here and helping out with this event.